Okay, we're lined up where we need to go.
Hello, good morning, and welcome to our Facebook live stream. We are at Aurora BayCare Medical Center in Green Bay, Wisconsin, where we're going to learn about a new treatment for chronic knee pain. The treatment is called cooled radiofrequency ablation, or cooled RF for short. With us today is Dr. Thomas Wilkins, wearing the green leaded vest. He's a pain and rehab medicine physician with BayCare Clinic, Pain and Rehab Medicine. He's going to be our guide today. He's board certified by the American Board of Physical Medicine and Rehabilitation. Our patient today, relaxing on the table, is Linda Suzawith, and she's from Algoma, Wisconsin. Thanks, Linda, for allowing us to be a big fly on the wall.
Happy to be here.
All right. So as we watch today, Dr. Wilkins, hopefully you'll be able to explain how cooled RF works, it provides pain relief and serves as a great alternative to opioid prescription medication.
Yes.
We'll also chat with Linda to just kind of get her perspective and see how things are doing. We will do our best to answer your questions in real time. And if we run out of time during this live stream, we'll continue to answer those questions, so keep them coming as soon as we finish this live broadcast. So let's get started, and I guess if you're able to work and talk at the same time, that'll be awesome. But can you tell us what exactly is cooled RF?
Well, the procedure that we're doing, radiofrequency ablation, is burning of the nerves that supply the joint, the knee joint in this particular case, with sensation. So people who have significant arthritis and are not candidates for surgery or want to put surgery off can have this procedure if everything else has failed, such as steroid injections, joint replacement fluid, the Synvisc or viscosupplementation injections. So this gives us an opportunity to burn off those nerves and provide pain relief, because the nerves aren't there to transmit pain any longer.
Yeah, let's talk a little bit about how that works. You say burn off the nerves. For our audience who have little to no medical background, what does that mean?
So the nerves that supply the joint with sensation, what we do is we target them by using the X-ray, and then we use heat to essentially melt or cauterize the nerves so that the nerves no longer exist to be able to transmit the pain.
Okay. And then how does that benefit people?
Takes away your pain.
I was going to say, I'm assuming they just don't feel pain in that area anymore.
Right, and that's the goal. The goal is, it doesn't get rid of the arthritis that the person might have, but what it does is it gets rid of the ability to feel that arthritis that they have, so that they can improve their function in life and have a better quality of life, provided that everything else has not been beneficial for them.
Okay. And while we're doing this for the knee today, cooled RF has other applications, correct?
It does, yes. We also use it for the hip joint.
Okay.
This very specific technique we use for the hip joint, and there are some other variations that can be used for joints in the back as well.
Okay. So you want to talk a little bit about what's going on right now? This looks very high-techy.
Yeah, so what we're doing is we're lining up with the X-ray the targets that we're looking for where we know that the nerves run, because the anatomy of the system, we know exactly where the nerves run based upon the landmarks of the bones.
Okay.
So we use the X-ray to guide where we're going to go, and then what we're doing is we're hooking up to the machine now, and we're going to run a little test with a little bit of electrical energy to test our location to make sure that we're where we want to be.
Okay.
So, Linda, you just need to let us know if you feel anything with us. So,
And I'm assuming she's numbed up before any of this even started?
she was numbed up before this started.
Okay.
And normally we numb before everything. As we got her all prepared, we did all that numbing before we went live.
Okay.
Okay? So here's the test, Linda. Let us know if you're going to test the first one.
5, 1, 1.5, and 2,
Good. And then here's the second one.
1.5,
And what is this you're doing right now?
So what she's doing is she's putting a little bit of energy through the probe at this point to stimulate the nerve.
Okay.
So what we don't want to do is we don't want to stimulate nerves for other areas.
Mhm.
And if we were going to stimulate nerves for other areas, she would let us know if she was feeling things elsewhere other than
Okay.
in her knee.
Okay.
And so at this point, we're going to further numb up with some local anesthetic before we actually do the nerve burn itself.
Okay. Did you feel a little something, Linda? No?
The first initial, like when he freezes it, you feel like he usually says, pick and burn, and he's right on cue. The burn is like 2 seconds, and,
Okay.
That's it.
Okay. Okay. And Dr. Wilkins, how does somebody know if cooled RF is the right procedure for them?
Well, they obviously have joint pain, but there are a number of different people that would be eligible for that. Give me just 1 second. I want
Yep,
to tell Linda
absolutely.
something. So the machine is priming itself right now. I'll let you know when it's going to start warming up. People who have chronic knee pain, who are too old for surgery,
Okay.
too young for surgery. Their surgeons want them to have more years on them before they do knee replacement surgery.
Mm-hmm.
Too sick for surgery. Sometimes people have too many other medical problems that really don't let them go under anesthesia for surgery.
Okay.
Or people who right now is not the time for surgery and they need to bide themselves some time because they have other things in life that just doesn't afford an opportunity to go through that surgery.
Okay. And then is this procedure, is it referred by one's primary care physician, or can folks just reach out to you at pain and rehab medicine and ask for this or ask for a consult? How does that work?
We can do it in any way. We do take referrals. Oftentimes, the orthopedic surgeons themselves are the ones that are referring patients to us.
Mhm.
But they can come through primary care or people who are off the street that want to learn a little bit more about it. We don't necessarily require a referral.
Okay.
So we're at maximum temperature there. So everything's going smoothly.
Okay.
So once the probe is in and the temperature rises to the point at which the nerves will get burned, this is about a 2.5 minute process where we just sit here now and allow the machine and the probe to do its job.
Okay. So that's in progress right now?
That's in progress
Okay.
right now.
Okay. All right.
Yep.
Well, while that's going on,
Yep.
why don't we talk a little bit? You've said in the past, in past conversations, that cooled RF is an ideal alternative to opioid pain medication. Let's talk about that a little bit.
Yes. So, as everybody is probably quite aware, it's in the news everywhere. The use of narcotic or opioid pain medications has become a significant problem
Mhm.
in our society.
Mm-hmm.
And through CDC recommendations and essentially the recommendations coming on down through all the pipeline channels, we're really trying to get away from excessive use of opioid medications for chronic musculoskeletal pain.
Sure.
So techniques like this allow us to eliminate that pain so that the pain isn't there causing people to come seek additional medications. In the past, when there was nothing to do, medications was pretty much it, and everybody would throw medications at the situation. Now we have alternatives to get rid of that pain, so we
Right.
don't have to take medications.
Great. All right. Well, we're at Aurora BayCare Medical Center in Green Bay, Wisconsin, to observe a cooled RF treatment. Dr. Thomas Wilkins, a pain and rehab medicine physician with BayCare Clinic, Pain and Rehab Medicine, is our guide today. He's board certified by the American Board of Physical Medicine and Rehabilitation. Our patient today is Linda Suzawith from Algoma, Wisconsin. Thanks again, Linda, for allowing us to be a fly on the wall. So, let's talk to Linda for a sec if we can. Is that okay, Doctor?
Yes,
You can
go
move
right ahead.
All right. So, Linda, talk a little bit about what brought you here today.
This is the third year I've had this done. June of 17 was the last time I had it done, and it had lasted like a year.
Okay.
I believe this one may last a little longer. Dr. Wilkins can say that, but this is I had my left knee done on Friday with this. This is the first time I've had the Coolief. I had my hip replaced in January of 16. I thought my knee was gonna have to be replaced the next fall. I had tried the steroids and Synvis, I think it's called.
Sure.
And they weren't working.
Okay.
10 years ago they worked, but they quit working. So my orthopedic surgeon, Dr. Schnabelt at Aurora,
Oh, yeah.
he suggested I try this, and I did, and I'm very happy with it.
Okay.
I probably at some point I'll still have to get replacements on both knees, but it's let me do, you know, whatever I'd like. I'd say it's probably relieved 95% of the pain
Oh, nice.
I've
nice.
had. So.
So talk a little bit about the challenges that you had with the knee pain. I mean, did it hinder your quality of life?
There'd be times like I couldn't hardly do stairs. I kept going, but there was constant pain.
Yeah. So at what point did you say enough is enough? I've gotta see somebody about
When
this.
my orthopedic surgeon said there's nothing else we can do.
Okay.
You know, it's either you decide you can try this, or you know, decide if you want to proceed with knee replacement. I'm not the older one that can't do it, so I'm more on the younger side
Sure.
where they said if you can hold off to,
Sure.
you know, to not have it, you know, done more than once a replacement. So
Okay.
I recommend this to everybody. I've had a lot of success.
Okay. Great. Great. Let me talk a little bit about your expectations for today. So you're expecting to walk out of here and fill in the blank.
Just live a normal life without pain, be able to go for walks and, you know, up and down stairs and just do daily activity without pain.
Okay, great. Looks like we have a question coming in. Is there an area numbed before the probe is inserted?
Yes, there is. That numbing is taking place off camera while you were talking
Yep.
to her. We were just numbing up the
Yep.
person before the probe was placed. And the first set of probes, we had numbed that prior to going live.
Yeah.
Yes.
The second part of that question is, will this work for chronic back pain?
We do have radio frequency procedures available for chronic back pain, and that is a big portion of what we do, yes.
Okay. Are any of these cooled RF procedures, that's another question, are any of the patients sedated? Does anyone have to be sedated to do this?
Most of the time, we don't sedate patients for this. And that's predominantly because this is a minimally invasive procedure that's
Yep.
not very painful. But secondly, we do like to communicate back and forth with the patient because we need patient feedback
Sure.
during the process.
Sure.
So right now, we're going to run those tests again on these two. So we're just running 2 tests again
Okay.
just to check our location.
Well, and for those of you just joining our live stream, we're here at Aurora BayCare Medical Center in Green Bay, Wisconsin, to observe a cooled RF treatment. Dr. Thomas Wilkins, a pain and rehab medicine physician with BayCare Clinic Pain and Rehab Medicine, is our guide today. He's board certified by the American Board of Physical Medicine, and our patient today is Linda Suzawith from Algoma, Wisconsin. Thanks again, Linda, for allowing us to observe your appointment. Dr. Wilkins, while there's kind of the lull, you're going to do this test again.
Yep.
Can you talk a little bit about these awesome vests that we're wearing today?
Yes, so this is done in the pain treatment center where we use x-ray to guide. And so from an x-ray standpoint, even though the x-ray that is done is minimal exposure over a period of time because we and the rest of the staff in the room do this in a number of times, it does add up. So the lead is there to protect us from that X-ray exposure.
Awesome, awesome. All right, so
Temperature's
exactly
starting to warm up again.
what's going on now?
So right now, we've already placed the probes for the second set of burns. There's a total of 4 nerves that we do. We did 2 the first time. We're doing 2 the second time here. And we're just warming up the probes to the proper temperature. And those have gotten up to maximum temperature at this point. So that's as bad as it's gonna get, Linda.
And this is where the nerve burn takes
This
place?
is, the nerve burn is
This is
taking
it?
place right now as we
Okay.
speak.
So what does a patient have to do to prepare for cooled RF? Did Linda have to, I don't know, fast last night or any of that stuff?
So there are procedures that we have here in the pain treatment area where we prefer people not to have a lot of food in their stomach ahead of time.
Mm-hmm.
And that's mostly not because they're under anesthesia or sedation, but that's mostly because of, sometimes people come in with some anxiety and they have, Linda is not one of those people.
She's not one of those.
But people who have anxiety or something might have an upset stomach, and it's more for
Okay.
helping them feel a little bit better.
Okay, okay. So is this pain relief? Is it instant? When all is said and done, is Linda walking out of here pain-free, or does it take some amount of time for things to
I'll let
cool
Linda.
off, so
I'll
to
let
speak?
Linda answer that. I think
Yeah.
every patient has a slightly different experience when it comes to when it actually kicks in.
The first time it took a little longer, I'd say maybe like a week or so.
Okay,
The first time I would have these like jabbing pains like I used to have.
yeah.
And it probably within a week. Now, the last couple times I've had it done, it might be a day or 2, but the pain is minimal, not as bad as it would get, and then it just kind of fades.
So is it a gradual decline in pain intensity, or just one day it kind of shuts off?
It kind of just shuts off.
Oh, okay. All right. So then we already talked about this, but for those just joining our live stream, do people need a referral? Can they come in off the street? Talk a little bit again about how that works.
Yep. Again, we'll see people either through referral or through self-referral. There will be people that know that they have a problem, know that they have an issue that they want to discuss, and just call up directly, and we see those people, on self-referral. We don't necessarily require a referral from another physician.
Okay. People are going to ask this. They ask this of all our procedures that we cover via live stream. Does insurance cover this?
What I will say is this is a Medicare covered benefit, and most insurance companies cover that as well.
Okay.
Mine covers it.
Okay. Good to hear. Good to hear. So is that kind of it? Is that?
Yes, so that's the procedure. We're
Yeah.
all done. Linda is,
I get to go get coffee and
she
cookies.
gets to go get coffee and cookies now.
So generally speaking, from prep to finish, how long does this usually take?
For this particular procedure, from the initial prep, which was a couple minutes before we went live,
Mm-hmm.
to completion is anywhere from 20 to maybe 25 minutes.
Okay, that's not bad.
The actual procedure time you just observed right there.
Yeah.
Once we're in and the burn is 2.5 minutes times 2 because we did that twice.
Sure.
So the actual procedure time out of that 20-25 minutes is maybe 5 to 7 minutes.
Okay. And then does she just return to normal activity today? She just walks on out of here with a pep in her step, or how does that go?
Right, so our recommendations, and we'll tell this to Linda again, same as Friday, activity is tolerated afterwards. She will have some Band-Aids on the areas where we put the needles,
Mm-hmm.
and she needs to leave those Band-Aids on for about 24 hours. The only restriction that we have is we don't have you get into a bathtub or a pool or go swimming for about 24 hours to give those holes a chance to close up and heal up. Other than that, you can take a shower and let water drip over it as long as you just don't submerge underwater. And then its activity is tolerated from here, so there is really no significant recovery time.
Okay. Is there anything I didn't ask you that you'd like to share with the audience today?
So this is something that we've been doing here at BayCare and Aurora BayCare Medical Center. This particular procedure with the cooled process, we've been doing this for over a year, and like procedures for approximately 7 years. So this is something that we're very experienced in doing. Patients have been receiving outstanding benefit, and we look forward to seeing anybody who might think this is for them.
Great. Linda, how about you? Anything to add?
No, I highly recommend it. I don't know if it works for everyone, but
Yeah.
I highly recommend it.
Works for you though, right? All right. Well, thank you. That's our time. We'll continue to answer your questions online. If you want to learn more about this treatment option, visit us by clicking on the link on this post or call BayCare Clinic Pain and Rehab Medicine at 866-965-4380. Thanks for joining us and have a great day.